Evening, everyone. I'm Nancy Lomibow. I'm the program director at Cancer Support Community South Bay, and we are welcoming you today to a workshop titled Living with Metastatic Cancer. And before we begin, I just want to say if this is your first time, welcome to CSC South Bay's workshop series. We are a premier nonprofit organization providing emotional support, education, and hope to people affected by cancer. And we serve the South Bay, Long Beach, and Orange County, all at no cost. Our programs include support groups, networking groups, healthy lifestyle classes, social activities, and educational programs just like this one. If you want to hear more about your services or join our community, please visit our website. I will put our website in the chat box. And without further ado, I want to introduce our workshop speaker. So Susan Starr is an oncology nurse practitioner at the Hunt Cancer Center, and she's the director of Integrative Oncology for Torrance Memorial Physicians Network Cancer Care. So please help me welcome Susan, and thanks for joining us.
Thanks for having me. Good morning, everybody. You can hear me okay?
Yes.
Yes, thank you.
Great. So I love Cancer Support Community and all that they do for our community, and I really appreciate them reaching out to asking me to give some information and talk about this topic. So thanks again for having me. So what I'm going to be doing is kind of a few different things. I'm somewhat going to address common long-term side effects of cancer therapy, because we know with metastatic cancer, of course, if most people are on treatment, many people, are living a long time, and it's still important to take care of ourselves in terms of the side effects that can come up. So I'll go over those side effects for a few slides. Then I'm going to address chronic low-grade inflammation and the effect on cancer and what that means and why that's important. We'll address strengthening your body and mind to help improve tolerance to therapy, increase resilience, and to help reduce cancer recurrence and progression, as there's a lot of more information and studies showing that link between kind of healthy body and better response to treatment therapy. And then I'll also review integrative oncology and lifestyle medicine and why they're important to incorporate into your daily life to really help improve overall quality of life and overall health and wellness. So metastatic cancer we see it as a chronic health issue now. It's really no longer pigeonholed as a terminal disease, which is how it was for many, many years. Because now we have many patients that are living for a long, long time, and often unseen by anyone who doesn't know their situation. So I have a lot of patients with metastatic cancer who are working full time and have chosen not to tell people in their office because they're not losing their hair or they're not very sick. It's manageable. So it's a really different situation now than it was 30 years ago. And I bring up 30 years ago is when I was 20 and taking care of my mother with metastatic breast cancer. I don't know if I internalized it at that time, but really looking back, it was, a matter of a few months for her. And ultimately, that's very, very different now. The type of cancer that she had and the markers that she had 30 years ago, if she was in that same exact situation 10 to 15 years ago, she would probably still be alive, just showing kind of the immense progression of the treatment options that we have for really turning metastatic cancer into more like a chronic illness. It is similar to as what I tell people is like blood pressure or diabetes. If it's a lifelong diagnosis, but you're on medications regularly to keep it under control. So people are living longer, as I mentioned, they're tolerating the side effects much better. And there's also much better supportive care in terms of managing different side effects that come up. So immunotherapy, targeted therapy, for example, have really changed the landscape of cancer treatment. And really the focus or the goal is to find the treatments that's the most effective or more effective with less toxicity or side effect problems. And that's what we've been able to really do over the last few years with the invention these therapies now being available for treatment. So I want to also mention that it's complicated too, metastatic cancer, because I think a lot of people who don't have cancer or metastatic cancer don't always really know what that means. And they don't understand that, treatment is ongoing, or that the goal is stability of their scans. And that's always a little bit hard concept. And so I always try to take a moment with my patients who bring it up to me to kind of explain that. I had a woman last week who was on a 6-month follow-up for her breast cancer, and cancer-free, and she had a friend diagnosed with metastatic cancer. She's asking me what that means. So really kind of helping to explain how this is very different nowadays, and with a lot of treatment options. And I know it's very different for everybody, for the type of cancer that they have. So I'm somewhat speaking in general terms. So really, for the goal for today that I'm hoping to do is to inspire hope and resilience, survivorship, and quality of life by focusing on things that are in your control. And a lot of those things have it to do with integrative therapies and lifestyle medicine. So that's why I'll really be focusing on those things for the second half of this talk. So if we start with the most common cancer therapy side effects, or cancer related or cancer therapy related. If you look at all these things that's listed here, and there are certainly more that are not listed here, but peripheral neuropathy, fatigue, sexual function distress, anxiety, hot flashes, weight changes, GI changes, heart issues. And the thing that I like to always look, all these things, these different side effects that potentially someone could experience, that what is the one thing that improves, prevents, or has a positive impact on all of these things? There's one specific thing that can really address all of these, and that is exercise and physical activity. So that's a really big component of integrative medicine and lifestyle medicine, is really incorporating that in. And I'll talk in more detail about what that means. It doesn't mean you have to go to the gym for an hour every day. I don't do that. But it's just about really being physical active and find things that you enjoy just to stay moving. So I want to just mention that there was a study in Nature Medicine in July of just this year. It was called Supervised, Structured, and Individualized Exercise on Metastatic Breast Cancer. So this is a randomized controlled trial that for metastatic breast cancer patients who found that there was significant reduction in their physical fatigue and significant improvement in their health-related quality of life. And this is really important because a lot of the clinical trials that we have looking at fatigue and pain and quality of life, many a times those are on adjuvant or people who do not have metastatic cancer. So this is an important study because they're starting to look more into metastatic cancer, and really also helping to show that all these different lifestyle changes can also be effective and helpful for people with metastatic cancer. Last year in the NIH, there was a report that really looked at evaluating exercise and how it's a promising agent against cancer. And to just not deep dive too far into it, but I think it's important to understand what exercise is doing. I mean, we all know it's good for our heart, helps with weight, you feel better, those kinds of things. But specifically, it's reducing the tumor development. So exercise has an effect on our hormones and balancing our hormones. It helps reduce systemic inflammation. It helps increase insulin sensitivity. And that's important because we know with sedentary lifestyle, with not eating very well, our insulin doesn't work as well. So we just have, in terms of getting the glucose out of the bloodstream. So our glucose just tends to go up. That leads towards diabetes and other chronic illnesses, including cancer. So exercise actually increases the sensitivity of insulin, and so it can do what it's supposed to do. It augments antioxidants, it boosts the immune system, and has a direct effect on the tumor itself. There's more clinical trials looking at exercise and nutrition and fasting in terms of their effect on the tumor. And some already really showing that if two groups of patients receive standard care therapy and one has an exercise program that they're to be participating in, and the other one just regular daily activities, really those so far are showing that those with the regular exercise, their tumor shrunk more on follow-up imaging. So there is this impact actually on shrinking the tumor, more so than just on the treatment that someone's receiving. So exercise should be a complementary part of the medical treatment for cancer patients, and it may contribute to cancer prevention and co-treatment. Effective exercise may predict stronger association with cancer and could supplementarily be embedded in clinical practice to improve disease progression and prognosis. So this, I think, is so important that it should really be seen as a prescription, like a pill that you're supposed to be taking. It really is an important part of cancer treatment in terms of tolerance, and as we're learning more and more actually on the cancer itself. This is a difficult slide to read. I apologize for how I brought it into this talk, but ultimately what this is showing is that the effects of exercise on health-related outcomes. So if you look at the far left, cancer-related fatigue, quality of life, physical function, anxiety, depression, lymphedema, all have research showing that cardiovascular, resistance training or weight bearing, or a combination of the two, have an impact on improving all those things on the left hand side. So again, not just kind of like, oh, it'll probably help and it's good for you, but actually research showing it can significantly help improve quality of life, fatigue, etc. And then on the bottom, there's a little bit less evidence or moderate evidence for bone health or treating osteoporosis and improving sleep. So again, just more information on how much data exists in terms of the benefits of exercise. So for the next few slides, I'm going to go through cancer and cancer therapy side effects, what they are and how to manage them. And again, I'm not talking about everything, just more the things that come up more acutely that I see, or even the things that are more kind of long-term that maybe get pushed off on the back burner. You know, when someone's being treated for cancer on a regular basis, we might forget to pay attention to the bones or the heart. And I think it's important, especially as people are living decades longer with these diagnoses, that it's really important to focus on making sure all those things are taken care of as well. One side note, I have a lot of patients that stop seeing their primary care doctor because they're just on the track with us in oncology. And I always encourage them to get back on track with their primary care because they are often the ones that will still be looking at diabetes, cholesterol, thyroid, which we may or may not be looking at depending on various things. So important to keep up with your primary care to evaluate those other things that are non-cancer related. So peripheral neuropathy is the damage to the peripheral nerves, your fingers and toes. It can, get worse even after you've finished one treatment and you're going on to another treatment. It can still even get worse for a couple months after finishing the treatment that was the causative agent. Can be temporary, can be permanent. Most often it's permanent or lasting longer, especially in group where people are on ongoing therapy. So we will talk about a little bit kind of what to do about peripheral neuropathy. We have, so the oral prescription medications like gabapentin, Lyrica, Cymbalta, some of you might already be on those things. They can be very helpful. Acupuncture has been shown to be very helpful. We have, my husband's an acupuncturist, so we refer a lot of people to acupuncture just in the community, not just necessarily to him, but ultimately I just hear firsthand so often how that can be helpful. It may not be helpful for everybody, but it's always worth a try, especially if someone's trying to avoid taking extra prescription medications. We have one of our patients here that is having acupuncture regularly for their neuropathy and has had a significant improvement. So definitely can be helpful. We've heard someone say that it's not helpful. Know that there's other people that say it is helpful, so it's always worth a try. Occupational or physical therapy can be helpful just in terms of muscle strengthening and balance. If you have a cancer rehab physician or provider in your network, it's a good idea to try to see them. Cedars has one, and Dr. Chang comes down to our cancer center a couple times a month as well, and he can be helpful in terms of treatment options for neuropathy. It's important to exercise. So I don't mean to sound like a broken record, but that's going to come up a lot. And staying active, dancing, yoga, Tai Chi, all these things tap into our motor neuron skills and can be helpful in minimizing neuropathy or managing it better. There's various topicals, Vicks Vapor, Conquer Cream, Capsaicin Cream, topical CBD with menthol can all be helpful. Cedars does a high dose capsaicin therapy. So if you're hooked up with Cedars, that's something you can try for your neuropathy. And then supplements, B vitamins, often, B12 is low and that can have a direct impact on nerves and your nerve endings. So always have your B levels checked and consider starting B12 if it's low, or certainly if your provider tells you to do so, but that's something to look into. Alpha lipoic acid, we're using that a lot more for our patients. And I've had some that say it doesn't work and some that it helped tremendously. So again, just one of those things to try. And omega-3s. And then sometimes cannabis can be helpful for people as well, or medical marijuana. So insomnia and fatigue, I know I'm not telling anybody anything new, but ultimately, look at other things that can be causing the insomnia and fatigue. If you're anxious or depressed or stressed, that's going to affect your ability to sleep, and you're going to feel more tired. Look at the medications you're taking. Steroids can cause a lot of fatigue throughout the day, and then insomnia if you're taking a lot of medications, if your nutrition is poor. So really making sure all these things are addressed, other than seeing a therapist, which is excellent and great to help with various things, making sure you're looking at all these other things I mentioned as well. Fatigue can be not just being physically off or tired, but mentally or emotionally exhausted. Maybe physically you feel fine, but just emotionally you're drained from getting a new diagnosis or having to change therapies, and recognizing that's really going to have an impact on your body as well. And I do want to mention here, if you're having, insomnia or fatigue that are worse, please always touch base with your doctor, because sometimes it can be something like your thyroid level is off. Someone's getting more and more fatigued, and we eventually do a thyroid panel and their TSH is through the roof, and no wonder this person can barely get out of bed. So really important to always make sure that you're letting your providers know to make sure you don't have any ongoing anemia or thyroid issues or other vitamin deficiencies, as I mentioned. So recommendations. So these are, again, probably nothing new to anybody, but I think it's good for me even just to read through it to remind myself that these are all the things to do, since we know insomnia or sleeping well is so important. So good nutrition reduces fatigue and also may improve sleep. So I'll talk a lot more about nutrition later. Avoiding or reducing alcohol. We know that drinking alcohol at night, although it makes you feel sleepy initially, is disruptive for a good night's sleep. And limiting caffeine, or especially avoiding it in the evening hours. Physical activity or exercise has been shown to improve sleep, as well as reduce fatigue. And that can even just be 5 or 10 minutes once or twice a day. So even if you're someone that's just wiped out and you're having difficulty getting up and moving around, just that little bit is better than nothing. Mind-body activity, so deep breathing exercise, meditation, mindfulness, music therapy, all these things can be helpful in terms of managing insomnia and fatigue. Stretch for 5 to 10 minutes before bed, as this improves muscle tension and blood flow in your body. So if you just take 5 minutes right before you bed, do some gentle stretching, that would be helpful. You want to shoot for 8 hours of sleep. You want to avoid long naps during the daytime. And if you are someone that's napping more, I recommend setting a timer, because then your circadian rhythm and everything is going to be off. So you really want to try to be awake most hours during the day. And then sleep hygiene, Google this if you haven't already, but these are all kind of basic things that have a fixed wake up time, consistent routine, prioritize your sleep, wind down before bed, don't use electronic devices before your bed, black out your room if you can. And probably one of the biggest things is avoid eating 3 hours before bed. I know that's hard for a lot of people to do, especially if you're working, but trying to get that 3 hours from your last bite to going to bed can be really instrumental in promoting a better night's sleep. Cognitive behavioral therapy for insomnia is not easily found in the community, but some people do it. We're trying to implement it here at our cancer center, hopefully by next year. But this is a therapy that identifies thinking patterns that you can change, or thoughts, how you feel about sleep, and kind of get to a root cause to help better sleep. So that's, if you have access to that, that would be a great thing to do. And then other treatments like different supplements can be melatonin, magnesium, which is probably one of my favorites. So magnesium, or the Calm powder. It's a little blue and white bottle that you can find at the drugstore. This came up from a cardiologist, integrative physician at Scripps years ago from a conference I went to, and he recommends all his patients to take it because it can have an effect on kind of relaxing the muscle. So good for your heart, for your muscles. If anyone's having muscle twitching when they go to bed or difficulty sleeping, it actually makes you feel a bit sleepy. You could also just take a pill for them, 250 to 400 at night before bed, knowing that sometimes it can trigger or worsen diarrhea for some people, so to be cautious of that. THC can be helpful. Now, just a quick thing here, THC, the medical marijuana, seems to be better for sleep than CBD. I've had patients do plain CBD. It doesn't always help sleep and can create a little bit more of an anxiety feeling. Again, everyone's different. It's a little bit of try what works for you, but I tend to see that the THC component of the medical marijuana works better than CBD for insomnia. Essential oils, lavender, bergamot, for example, can be helpful. Valerian root or chamomile teas. If you're a tea drinker, again, try to avoid it late at night so you're not drinking more fluids to have to wake up and pee throughout the night too much. And certainly there's prescription medications, which I won't go into. You can talk to your provider about that. There's other things for fatigue, for L-carnitine, American ginseng. These things can sometimes maybe have an interaction with some medication. So that's important to talk to your doctor about that. But I put it up there because there's been some information and research that can be helpful. So it's something to look into and see if it's good. It may be helpful for you. Again, essential oils specific to for fatigue, excuse me, is peppermint, lemon. And then sometimes, or some patients, we will consider prescribing Ritalin or Provigil. And these are medications to help with fatigue. So for those who are really suffering and struggling with a lot of fatigue from their cancer, from their treatment, sometimes these prescription medications can be an option. So depression and anxiety, I won't go through this too much because I want to make sure I get to the other things. I mean, I think most everyone really knows what these are, but the point here is if you have depression, again, make sure all your iron and B12 and thyroid studies are checked because sometimes that can worsen depression. And you want to make sure that this gets addressed because if people are depressed, they don't show up to their doctor's appointments, and that can be more dangerous down the road for not getting appropriate medical care. So really making sure you're addressing any depression as well as anxiety, because anxiety can cause physical changes like increase your blood pressure, heart palpitations, poor digestion. How many times do you feel anxious and your gut starts to churn, or you can't fall asleep at night because your mind is spinning, or you're waiting for your doctor to come in to review a CT scan results and your heart's racing. So all of these things be good to kind of be aware of what they are and have mechanisms and way to help reduce that. And I'll touch on that in a moment. And of course, distress. These are all the things when you come into the doctor's offices, they're always checking. We have those checklists of anxiety and distress and depression. So hopefully that your provider will see that what's going on and help you find ways to help address those things. And sometimes, these things can be from different medications people are on, or just having a sense of PTSD that they can't get past from their initial diagnosis, or if there's isolation or they're not out and about with people, or just fear of recurrence. So all of these things can bring up, or fear of progression can bring up depression and anxiety. So of course, there's medications that can always be prescribed. So talk to your medical provider about that. Seeing a licensed practitioner. If you're really having a difficult time getting past the point of just, essential oil is not working or deep breathing is not working, see a licensed provider, that's the cancer support community, or we have our social worker here that can refer people to therapy. But sometimes that's really important to help process through some things here and there, aside from just kind of the other integrative type things that are available. Exercise and activity, so yoga, tai chi, and qigong have all been helpful in showing improved depression and anxiety scores. Acupuncture as well, breath work. I'm sure you all have probably heard about this at some point, but 4-7-8 breathing from Dr. Weil at University of Arizona, integrative doctor there, or box breathing. Google these if you're not sure what they are, but they're just breathing mechanisms to help kind of slow your heart rate and be in the moment. And I do tell people, if people have scan anxiety, or they, for the week before their mammogram or whatever, they just feel really anxious about it, that's a time to really implement breath work. Or when you're waiting again in the doctor's office before they walk in, do the 4-7-8 breathing or the box breathing to help kind of just ground yourself, be present, clear your mind, because not only will you be able to be more relaxed, but you'll be able to think more clearly and be able to be kind of quicker with asking questions real time with your provider when they're in the room with you. So good time to just kind of know that centering or that calming can help expand and clear your mind before you're having a conversation about something really important. Essential oils, lavender, bergamot can be helpful for these. Social support, church, sports, community activities, family, friends, holidays, things that you look forward to, and you get that extra support are really helpful. As you all know, since you're all to the cancer support community, you're probably on top of that pretty well, and that would be great. Nutrition, so reducing processed foods high in sugar, eating whole foods, focus on foods that support the microbiome. And what that would be is, high fiber and fermented foods to get those pre and probiotics. We know that gut-brain axis is an important thing. And for those of you who may not know, that's just this connection of what we eat and the effect on the microbes in our gut, and how that plays a role in our nervous system and affecting things like anxiety and depression. So if you're having a high fiber, high sugar, high carb diet, really poor diet, packaged processed foods, you're not giving what your gut microbiome needs. And it can create more kind of an inflammatory response and have an effect even on depression and anxiety. So really focusing on those kind of healthier foods is also important for mental health wellness. Supplements that can be helpful. So ashwagandha, that kind of became big during COVID, but that's something that usually has pretty minimal interactions with things. But again, always check these supplements. We recommend to check supplements with your provider. And even if your provider is someone that says no to everything, that's what you need to follow. But there's a bit of kind of gathering information on your own, and just seeing what is best for you and what would be safe to do. L-theanine can be helpful, chamomile can be helpful. And again, making sure you're not deficient in vitamin D, B12, which can have an effect on these mental health wellness also. If you look at this ASCO Society of Integrative Oncology grid that is really nicely put out, this is the research that shows that these types of mindfulness-based interventions can be helpful for anxiety and depression. So if you look at the turquoise box and the purple box, one's anxiety, one's depression. If you look in the far left column of both during active treatment, you'll see that there are multiple research studies that have made this mainstream recommendations to help with anxiety and depression, mindfulness-based interventions, yoga, hypnosis, relaxation therapy, music therapy, reflexology, lavender essential oil. So these are things that have been proven to be helpful and are always worth a try. And again, most all these things you can probably find in cancer support community. So just a quick discussion on cardiac health. So a lot of different drugs here, chemotherapies, targeted therapy, immunotherapy can all cause effect on heart, but not all therapies have this cardiotoxicity, but many do. I think the important thing is on the right-hand side, the non-modifiable versus non-modifiable risk factors. So what can you not change? The type of cancer therapy that you're given, if you've had radiation to the chest wall, if you're over 65, those are things you can't change. But what are modifiable and things that you can do to change or have an impact on heart health are obesity, type 2 diabetes, hypertension, cholesterol, smoking, dietary intake, exercise, and mental wellness. So these are all things that you have impact on, have control over to help with cardiac health. So if you see a cardiologist, awesome, keep doing so as you need to. If you don't, there is a cardio-oncology consultation that you can have here with one of our groups, Dr. Bauer, and there's another cardiologist there as well. I'm blanking on his name at the moment, but they do these cardio-oncology kind of primary care prevention consults. So if you know you've had a history of cardiotoxic drugs, family history, but no one's ever recommended to see a cardiologist, you could still see one of these cardiologists to have that consultation and really look to see what your risks are for any cardiac disease and just making sure that everything is functioning well with your heart. So treatment strategies, as probably nothing mind-blowing here, but weight loss, regular exercise, healthy diet, Mediterranean diet. The DASH diet is a hypertensive diet, and mind-body mindfulness activities to reduce anxiety and stress on the heart. Osteoporosis. So this is something everyone should really just be aware of any type of treatment that they've had in the past, whether it's chemotherapy or aromatase inhibitors, which many people are on or currently on with other targeted therapy agents. And a bunch of risk factors here that you can see: age, genetics, gender, body frame, menopause. I mean, the list goes on in terms of what can impact osteoporosis. So everyone really should be having or I would recommend a bone density every 2 years just to see where your bones are. If you have, pre-osteopenia, keep up with pre-osteoporosis, which is osteopenia, keep up with exercise. If you have osteoporosis, then there are medications that can be prescribed for that. On that third bullet point down, different oral medications, sub-Q injections, IV infusions, versus having referral to endocrinology. We recommend supplementing with vitamin D. If you're not on vitamin D, I generally recommend for people to start vitamin D at 1,000 or 2,000 units a day, but have that level checked with your provider to make sure it's at a good level, which we usually see between 40 and 60. Weight-bearing exercise is helpful for your bones. So back to the exercise again, but here you really want to do the weight-bearing, and it can be any of those things that you see listed here: lifting weights, aerobics, jogging, elliptical machines, gardening. As you're up and down, I would even include that as well. High intensity, high impact exercises give the most benefit. So really the best recommendation here is to do strength training with an exercise therapist or a trainer, because it's safe, and then they can really help see where, if you have any deficiencies or what your strong parts are, and work on a routine that is best for you, that can give you the most impact. And I tell people sometimes just go twice, just see somebody 1 or 2 times, so you have kind of a general idea of what to do, and then continue doing that on your own at home. Oh, I'm so sorry. I wanted to finish here. So nutrition, calcium-rich foods. I don't necessarily recommend a calcium supplement. If you look at the national USPSTF guidelines, the jury is out, and there's not a strong recommendation for calcium supplements. Now, before anyone stops taking it, talk to your primary care doctor, because it really is, it's kind of you can speak to 100 doctors and 50 will say do it, 50 will say don't do it possibly. So ultimately I focus on having people get it through their food. So, and not just dairy, but it could be all the dark green leafy vegetables, tofu, beans, sardines, salmon, other things that have calcium in them. So try to get that in your diet. Along with taking the supplement vitamin D. Magnesium foods, dark chocolate, avocados, nuts, not really hard things to eat, but getting those in your diet, as those are more yummy things, are good ways of getting magnesium into your diet, along with legumes, nuts, seeds, again, soy and tofu, edamame, whole grains and leafy vegetables, dark green leafy vegetables. Oh, I didn't mention this earlier. I apologize. I skimmed through it, but mind-body exercises to reduce stress, because there was actually some information showing that having stress releases something in the body that can actually have an impact on bone health as well. So stress can even be potentially related to osteoporosis. So again, kind of making sure you're reducing your stress. I'm going to just kind of quickly go through these last couple of GI changes. With one of the reasons why I even bring this up is, for example, there's a drug for metastatic breast cancer patients, or many times used in that setting, called Verzenio. It can cause a lot of diarrhea. So with any treatment that you're on, and if you're on it long term for a long time, it causes diarrhea. Yeah, of course you could take Imodium to stop it, but it's also worth looking, well, maybe there's certain foods that are now triggering it. We've seen people become intolerant to dairy. Sometimes just caffeine or very hot drinks or alcohol or spicy things can trigger diarrhea. So sometimes it's just adjusting your diet, seeing what those triggers are, eliminating them or avoiding them. And you might not need to necessarily take an Imodium every day along with your cancer therapy that's causing diarrhea. So it's worth always looking at dietary stuff, as well as, again, your microbiome, and getting in or taking a probiotic if you want to even try that. Imagine many of you are probably taking probiotics. That's fine if that can be also helpful in balancing diarrhea. Or constipation, trifecta for constipation: hydration, fiber, and activity. So you have the water to push, kind of hydrate and lubricate. You need your fiber to kind of push things through. You need your activity, which is kind of, in a sense, kind of squeezes your body, kind of move things through. So again, kind of the importance of that movement and activity. All right. So pain, lots of different kinds of pain, whether it's joint pain from aromatase inhibitors or Faslodex, which I know a lot of people take ongoing, or Lupron. There's also cancer-related pain from whatever the cancer is, if it's pressing up on some nerves or pressing on something that's causing pain. Peripheral neuropathy can be painful, surgical pain. So all these kinds, when I'm talking pain, it's any of those pains involved. And again, acupuncture is recommended for pain. I put anti-inflammatory diet because that can be helpful for the joint ache, sometimes just reducing foods that are inflammatory, high sugar processed foods. If you reduce those, that can have an impact. Supplements like glucosamine chondroitin, curcumin, CBD, higher doses of CBD, like 25 to 50 or more, can act like an anti-inflammatory. And fish oil, 2,000 milligrams a day, can be helpful. Activity, movement, exercise, massage, yoga, physical therapy, all those things, those movements can be helpful. Now, of course, depending on what your pain, what's your situation, you want to make sure you're doing things safely with a therapist or one-on-one with somebody. But that, again, kind of that movement is key. Meditation and mindfulness. There was a report in the NIH just last month, I think, showing that meditation and mindfulness was more powerful than the placebo in looking at pain or managing pain. So we always know like there's pain meds and there's, placebo meds, let's say, that this actually showed meditation mindfulness was even more powerful than the placebo. So doing nothing, really showing that there is a connection between mindfulness and having an ability to reduce pain sensors. And of course, there's always prescription pain medications. I try to always get to those last if possible, but they're always there as needed to help people if these things are not working or their pain is just so severe they need it, which is absolutely okay. So this is another one of those SIO ASCO guidelines. This is, if you see here, aromatase joint pain, general cancer pain, neuropathy, procedural pain, surgical pain, all these studies have been done looking at acupuncture, yoga, reflexology, massage, etc., showing a benefit in reducing all those different types of pain that are listed on the left-hand side. Now, on the far right, you'll see that it's lower intermediate grade evidence, or it's weak to moderate strength of recommendation. But all these things are not going to hurt you. So if you even get a little bit of a benefit or some benefit, it's definitely worth trying. So these are still things that are ultimately recommended things to try to help manage these different types of pain. Lastly, lymphedema. I just want to quickly touch base on this. Things that can increase lymphedema are obesity, lack of upper body movement, and infections. So for those of you who have had a history of lymph node removal in your axilla and you don't have lymphedema, these are ways to help prevent lymphedema from ever occurring in your lifetime. So trying to have a healthy weight, doing upper body exercise for that collateral circulation, and avoiding any infection. And then certainly always seeing a lymphedema therapist is a strong recommendation, as they can give more specific details on how to manage it and prevent it through various exercises. Okay, so last few slides, I want to get into a little bit more more of what you can do and how to incorporate these things and why they're so important. So chronic low-grade inflammation. So there's inflammatory patterns, things like poor diet, sedentary lifestyle, stress, and obesity all have an impact and can cause low-grade inflammation. We know that low-grade inflammation is associated with cellular mutations or changes in a cell that may stimulate cancer growth by creating a microenvironment conducive to cancer development. We also know regular exercise, nutrition, maintaining a healthy weight, reducing stress, sleeping well, all improve immune function, increases that insulin sensitivity I mentioned earlier, and lowers chronic low-grade inflammation. So all of these things are really getting at the root cause of a lot of chronic illnesses. So not just cancer, but other chronic illnesses that have to do with this low-grade inflammation. So there's enough research that recommendations for these things, nutrition, exercise, stress management, should really be considered a part of a patient's medical treatment. And that's what I mentioned earlier when I was talking about exercise, that just like you receive a prescription for your medication, you receive a prescription for exercise, knowing the significant benefit that has in addition to the treatment that you're doing. So the goal is really to make the body as inhospitable to cancer as possible, to help stop cancer from growing, developing, and then also has that impact on helping you feel better as well. So really kind of looking at empowering yourself. So what is in your control, how to regain power and control over your own life and body. And I know when patients or people are diagnosed with cancer, or especially metastatic cancer, there is this sense of you've lost control and you're just in the hands of your provider or your team. And although they have a huge role and an important role, and they are kind of taking care of giving these medications, you still have your own control of helping to create this anti-cancer body and anti-cancer mind, which I'll go into a little bit more detail in a moment. I want to just quickly review what integrative medicine is and lifestyle medicine. So integrative medicine uses all appropriate therapies, both conventional and complementary, to facilitate the body's innate healing response. It doesn't reject conventional medicine, and it doesn't recommend alternative therapies as primary treatment. So integrative medicine is bringing in all these things, Reiki, breath work, acupuncture, into what you are doing with your medical team at your oncology office, or the conventional treatment as it's called. Lifestyle medicine, it looks at the 6 pillars, which include and I'll talk more about this: nutrition, physical activity, stress management, restorative sleep, social connections, and avoid risky substances. And this is important for everybody, whether you're someone without cancer and you're preventing, someone with cancer and you're going through curative treatment, someone with metastatic cancer and ongoing treatment. These 6 pillars of lifestyle is for everybody, can have this benefit from following these things. Whole person health, I'm just throwing that out there. That's a newer term, and something that Torrance is trying to be more involved with, as the concept here is that it involves the whole person, not just separate organs or body systems, but considers multiple factors that promote health or disease. So it empowers individuals, families, communities, populations to improve their overall health. So that's something kind of you might be seeing more over time, a focus on this whole person health and whole person health care and health community. So nutrition for wellness for the anti-cancer body. So anti-cancer body is more focusing on the nutrition and exercise. And before I go to those links there, I just want to mention there's no supplements recommended for cancer treatment or prevention. So getting all these vitamins, minerals should be get from your food, except for vitamin D. That's the one where there's clinical trials showing the reduction in cancer recurrence. But it's the focus on getting your vitamins and minerals through your food. The Mediterranean diet has been shown to reduce all-cause and cancer mortality. So again, for everyone with cancer or history of cancer, for all their family members, the Mediterranean diet is really the best diet to focus on. And that, of course, includes fruits, vegetables, beans, legumes, fish, nuts, seeds, olive oil. I think most people probably have a good understanding of the Mediterranean diet. The American Cancer Society and American Institute for Cancer Research both agree that the best diet to reduce cancer recurrence and risk or overall cancer risk is a plant-based diet. So not to say you can't have some kind of meats, and I'll hone in what that ounce is and what that is, but really focusing on plant-based diet. And our dietitians here give a lot of great talks on food and cooking with plant-based diet, as I know sometimes that's overwhelming for people, but there's a lot of good resources here at Torrance Hospital on their webpage with the nutritionists or dietitians. So I'm going to see if I can get to this link here, and let's see if I can do this. And Becca, feel free to tell me if you're not seeing what's going on here.
Okay.
Please.
Are you in the
Okay.
share?
Yes, I think I'm there.
Yeah.
Now you can see?
Yes, American
great.
Institute for Cancer Research. Wonderful.
Perfect. Thank you so much. So this American Institute for Cancer Research, this is a great website, and I recommend everyone to go onto it at some point and play around with it and look at all this information. But if you go to this area that's, foods that fight cancer, it shows you all these different, fruits and vegetables that are listed here, things to avoid, cancer prevention, and recipes at the bottom. But what I really like about this page is if you click on broccoli and cruciferous vegetables, it goes in detail about what it is, how they work, clinical trials showing that there's a benefit in reducing colorectal cancer risk, as well as lung cancer, estrogen receptor positive breast cancers. And it goes into kind of more detail about the lab studies, human studies, as to why these cruciferous are vegetables are important for your health. So if anyone likes to really deep dive into more information and data, this is a great resource for that. So other than just saying eat fruits and vegetables, if it's helpful to look at this whole list and think like, okay, how can I incorporate this in my diet on a regular basis? Sometimes I think that is helpful. All right, so as far as the other site, I think I might have, let's see if I can get to this really quickly. And if I can't, I'll abort and then kind of explain to you what's on it.
You're back on the PowerPoint, so if you want to stop the share and go back to stop the share.
I do. I want to just open it because it went out of that.
Okay. And then stop the share and click on that web page.
Okay. Thank you, Rebecca. Okay, thanks for everyone's patience. I'm new to sharing this stuff, but it was so important. I figured I need to learn something new and figure out how to do this. So
Wonderful.
this
Can
is,
heal.
yeah, so this website Can Heal, which many of you may already know, but it's the cancer toolkit through University of Arizona Andrew Weil's Integrative Center. And what I really like about this is that you can go on to complementary therapies, and go learn more about, massage or aromatherapy or mind body therapies. And they have different links to different breath work kind of things or meditation. If you click on lifestyle, that's where you can get into diet and meal patterns. So kind of helping you kind of more figure out, what to eat through, Mediterranean diet, let's see, foods for low appetite, anti-inflammatory diet. And then the thing I really wanted to share, since I was talking about phytonutrients, are these anti-cancer superfoods. So I know many doctors say, do not take any vitamins, do not take any anti-cancer, antioxidant supplements, because it might impact certain therapies. But you can get them in your foods. Now, I'm not telling everyone to buy a crate of all these things and eat them every day, because that would be really high doses, but just mixing in Asian mushrooms into your foods, or flax seeds into your oatmeal or your shakes or your yogurt. And if you click on these, it tells you why they're important and what they can do for your health. And then some of them even have different recipes or more clicks on links as to why turmeric is beneficial or helpful. So sprinkling a little turmeric in your shakes or your salad dressing that you make, having a couple of glasses of green tea a day. So all these things can be helpful just to incorporate. But great website. So again, I recommend everyone to go to the Can Heal or the Cancer Tool box from University of Arizona. All right, so back to the slides. And let's see. You can see my slides again, Becca?
Yes.
Okay, perfect. So recommendations for cancer patients. So nutritional assessment and counseling should begin as soon as possible after diagnosis, with the goal of preventing or resolving nutrition deficiencies, preserving muscle mass, and managing side effects of treatments that may adversely affect nutritional status. Better nutritional status helps improve tolerance to therapy, improves fatigue, and helps strengthen functional status. So I don't know how many of you in your diagnosis immediately got a referral to a dietitian, but I think that's pretty rare. We're trying to do that more in our cancer center here, to have that be as part of the upfront treatment, or if seeing a dietitian. But really that needs to be just like a prescription for exercise, and immediate prescription to the dietitian to really focus on these things. So we go into the wellness and physical activity part for that anti-cancer body. So if you move your body, you improve your health. Now, again, always, if someone has difficulty walking or a new pain, don't push it. See your provider. Make sure you're safe and well to do various different exercises. But the recommendations here is monitor your daily movement or steps through an app, and take note of how much you're sitting as well. I was surprised to learn when I did, I think it was American Cancer Society, I stand at work all day. So I was thinking I was going to have a really high ranking on that, but my commute to work for an hour each way, sitting for dinner, added up to the point where it was like, okay, caution of sitting. So just being mindful of how much you're sitting along with how much you're standing. And moving. So if you're working full time, or if you're working at all, a stand-up desk is one way to kind of just be moving a little bit more. Walk more. So whether it's walk meetings if you're working, or take the stairs, park farther away at the grocery store. Again, kind of balancing your fatigue and how you're feeling, but just trying to walk more as much as possible. Develop a fitness routine. So start slow and build on it. Do it with a friend if that's helpful to keep you motivated. Whether you go to a gym, if you like that, great. If you don't like going to a gym, do YouTube. There's a lot of videos on YouTube that you can follow that are a few minutes, that have both cardio and resistance, and finding a combination of those things. 10 minutes is better than nothing. 5 minutes is better than nothing. I tell all of my patients, do 5 minutes minimum. Try to go up to 10, try to go up to 15, but something is better than nothing in terms of actual exercise, and put it on your calendar. I notice, with doctor's appointments and work or whatever's, picking up the kids, whatever the issue is, try to put in there that 10 minutes of some type of exercise to make sure it happens every day, and then have fun. I think the biggest thing is when exercising feels like work, and I fall into that where I have to do something that's more fun to kind of keep me entertained with exercising and movement. So whether it's going to the beach, or this time of year going to a pumpkin patch, cooking classes, trips, find things that are fun, or walking with a friend so you can talk and get caught up. Always a good thing as well. Physical activity, assessment, and counseling should begin as soon as possible after diagnosis, with the goal of helping patients prepare for treatment, tolerate and respond to treatments, and manage cancer-related symptoms and treatment-related side effects. So this quote, as well as the other one I didn't mention with the nutrition, about kind of upfront exercise and nutrition recommendations when someone's starting treatment, is really important and should be part of American Cancer Society recommendations. So I have a few minutes left. I want to get to some questions. I'll try to be quick because this will get a little bit redundant in a moment. But I have a few minute leeway after 11. I know you have a support group, Rebecca, so I'll defer to you if you want me to stay longer for questions. But reducing stress and creating emotional, mental resilience, or the anti-cancer mind. So we've talked about the anti-cancer body. Now we're talking about the anti-cancer mind. So connection with family and friends, number one. And I just want to briefly read from this book. I don't know if you can see it as I hold it up here, but I think it's been a really great book, Anti-Cancer Living, from Lorenzo Cohen. But he says here that they found support is the backbone on which all other lifestyle changes will either succeed or fail. Whether it is logistical, having someone take care of the kids while you attend a new yoga class, motivational, to help overcome entrenched eating habits, or psychological, to uncover deep emotional issues that keep you from being the person you want to be. The people you enlist to support you are key to your success. Establishing an effective, personally tailored support network is where anti-cancer living begins. So really huge emphasis on that connection of family and friends, and a cancer support community, which again is kind of that another family for people to help and be supportive. So mindfulness, meditation, breath work, spirituality or religion, depending on what your beliefs are, connect with nature, social support, just ask people to help, therapy, counseling, support groups. Music therapy is really healing for some, maybe not for others. I know for me, it's huge. So kind of finding those things that really help kind of have that sense of calming. Self-care, compassion, gratitude. I'm pretty sure Cancer Support Committee has classes on that. I know we do that here, but really kind of loving yourself and having gratitude and compassion for yourself. Just as if you have a friend that needs your help and is worried about something and you would be there for them, do that for yourself. Mind-body practices like yoga and Tai Chi. Exercise, stay active, movement, stretching, again, kind of all can be helpful in terms of emotional and mental resilience. And again, focusing on what's in your control. And if you're a list person, make lists, write it down, put it away so you're not ruminating, thinking about it, and can get back to doing these other things. So just kind of a little checklist here. So meditate, breathwork, mindfulness, try to do, I think it was like 12 to 15 minutes a day was what one clinical trial said. Finding some way to incorporate that, whether it's the beginning of the day, halfway through the day, or doing it twice a day, but that can be helpful again in kind of calming, centering yourself and stopping the mind clutter or the anxiety if you have that going on. Just stop for 5 minutes, stretch your arms, take a deep breath, get outside, just whatever's going on in your life, whether it's kids or work or a ton of appointments, take just 5 minutes and stop what you're doing just to kind of center yourself. And again, just have a moment of feeling good. Movement, walking, Tai Chi, yoga, 10 to 60 minutes is, like I said before, any amount will do. More is better, but 10 minutes, hey, I'm happy with that. The guideline recommendations are 150 minutes a week for overall best benefit health. But if you're having a lot of issues with your cancer therapy, you can only do 5 or 10 minutes. That's just fine. Be in nature. Forest bathing is something that came out of Japan, I think like in the 80s or 90s. And it's really about connecting with your natural environment. So if you have a forest, awesome. If you have like a little hiking trail somewhere near you, great. If it's a park, that's fine. But just kind of connect, or if it's just in your garden, but find just being outside in nature and bathing in, kind of connecting with your natural environment and disconnecting from your phone and appointments and things for a few minutes can be very healing. In fact, UCSF has a forest bathing virtual class that they do, which is you go wherever you are and then you log in and they walk you through this meditation. So find calmness in any form, whether it's reading a book, taking a bath, or having a few minutes of deep breathing. Have fun, laugh, do things that make you laugh. I know that's often very hard, but laughing is healing. And there are clinical trials showing that if you laugh, you actually has a positive impact on your health. And then some people self-reflection through writing or through a therapist or with your partner. So I'll just breeze through this. I know I keep saying that, but so much information I like to share. But we kind of talked about integrative oncology. This is really the modalities that can be included in that. That's acupuncture, aromatherapy, exercise or activity, massage, mindfulness, meditation, breathwork, music therapy, nature walks, or this ecotherapy that I talked about, or forest bathing, relaxation techniques, Reiki, sound baths, Tai Chi, Qigong, yoga. Most of all these things are online. You can find through various integrative centers, and I know Cancer Support Community. And then lifestyle medicine. And what I want to just briefly mention here is, physical, there's these 6 pillars, which I mentioned earlier. And if you just can try to incorporate these as much as you possibly can, that is huge. And so that activity, as I mentioned, is 150 to 300 minutes a week. Nutrition, focusing on whole food and plant-based. Stress management, 12 to 15 minutes a day and whatever works for you. Sleeping for 7 to 9 hours. Social connections, connecting with someone at least once a day to avoid loneliness. And then, of course, avoiding risky substances like avoiding smoking. But all of these things are all interconnected. So it's really kind of focusing on all these things as much as you possibly can. So we know that lifestyle modifications, looks at the whole person, and it can reduce cancer development, recurrence, and progression, but also improves heart disease, diabetes, osteoporosis, cognitive function. And I do want to just, well, I'll hold off on that for another talk another day. But this is, what we've been talking about through this whole kind of all comes together full circle in the end, these integrative oncology lifestyle modifications and all the benefits of exercise on physical function, your other organs in your body, not just cancer related, improving treatment tolerance. And this study in here on the 4th bullet point down reduces the risk of recurrence and development of cancer. 55% reduction in breast cancer recurrence, 25% reduction in all-cause mortality. I just want to mention here that yes, this is for cancer recurrence, but really we know that this can also be helpful for those who are dealing with metastatic cancer, and if they're looking more at really kind of reducing progression and making the most of out of the current treatment they're on, these interventions can be also helpful for that. Avoid inactivity, the mindfulness. And again, just briefly on the healthy weight, intermittent fasting, and we know we didn't really talk about that, but that again can be helpful for some people in terms of better sleep and reducing cancer growth. Food is medicine. Just real quickly on here, get your omega-3s from eating salmon and walnuts and flax. And you can take an omega-3, but you can get it in these foods as well. If you're looking to boost your immune health, again, you're not supposed to, most people shouldn't be taking antioxidants while they're on therapy. Depends on multiple factors. But if we generalize that statement, cook with mushrooms, citrus, and garlic in your foods, and you're getting immune boosters through your foods. Antioxidants like broccoli sprouts, berries, dates, cocoa. I mean, it's pretty easy to eat some dates and berries. And those things can be helpful antioxidants in the food form. And again, anti-inflammatories, olive oil, nuts, turmeric, green tea. So all these things, look at those on those websites I gave you from the Cancer Toolkit and can go into those in more detail. All right. The meat, I do want to mention there, because I said I would mention it earlier, that avoiding processed meat, as they are considered a class 1 carcinogen. If you're at someone's house, you're on vacation, you get served bacon for breakfast and you love bacon, eat it. Don't have it every day, and try to limit it and reduce it as much as possible. If you are a red meat eater, no more than 12 to 18 ounces per week is the guideline recommendation. All right, so to end on this quote from Donald Abrams, he's an integrative oncologist at UCSF. Cancer is like a weed in a garden. Integrative medicine helps make your soil as inhospitable as possible. So hopefully that's been helpful information. I know it's a lot. I appreciate your time and inviting me to come. And I do have a few minutes if there's questions, but I also want to honor that it's a support connected group after this. So Rebecca, you let me know.
Yes, Susan. How many minutes do you have available? Because I know you have clients as well.
I can probably go till 11:15.
Okay, wonderful. So for the 3 links, the 2 links in the book, I did put into the chat for anyone who wants to look into that. First question: do you have any oncologists that have had success taking a patient off targeted therapy after 5 years of no progression?
So The tricky part about that is there's always this question of what to do after someone has been on targeted therapy or immunotherapy for so many years. Because there isn't really any data to say, like in an adjuvant setting, if someone's on curative intent, like you go through, 6 months of this, you go through 5 years of this, and then you're done based on the studies. But if someone with metastatic cancer who is cancer free, let's say on their scans, there's that debate of keeping them on medication as a way of maintenance, because it's kept them cancer free or in remission, or nothing showing up on imaging. But that's always the big debate of what to do next, of taking them off. So I have to answer ultimately the question. I've seen people come off therapy because there's no evidence of disease on their scans, and they're off therapy for a couple of years. They have recurred, not everybody, but just one patient I'm thinking about, but it was a couple of years off therapy. I would say most of the time I see people on ongoing therapy, because there's just this idea, if it's kind of like someone's taking blood pressure medication or diabetes medication for life to keep it under control. There's that kind of mindset of keeping these medications going. Now, if there's a lot of side effects or intolerance issues, we might lower the dose or really scale back on the dose. But yes, I think it's always an option or something that should be discussed with your provider, as if you've been not sure if stability on scans for a while, is always that option to consider going off of it. But that's kind of the rationale as to why that's not an automatic, you go off of it this time. It's kind of that discussion between you and your oncologist.
Thank you. I did put my email into the chat as well if you like a recording of this workshop. I know there was a lot of great information shared. Next question. Can patients see your team if they do not have an insurance you accept? If yes, how can a patient obtain an appointment? And there's a follow-up of, are you able to share local acupuncture recommendation?
In terms of coming to our clinic here at the Cancer Center, the only way to be here outside, if the insurance is not accepted, would be a cash pay, basically, which can be very costly, and wouldn't always really recommend that, because that can really add up.
And then, do you have any local acupuncture recommendations?
Well, of course, we refer a lot of people to my husband, Susan Starr, but he's only down here in Redondo Beach once a week. He's otherwise up in Wilshire area, but down in this area, we do have a couple. I don't have them on top of my head, but there's a couple others. We have their business cards we refer to. I don't know them personally. I imagine you guys would maybe have some local acupuncturists that you recommend or refer to, or would be able to give that information.
If we call the Hunt Cancer Center, would someone be able to refer them to those resources?
To an acupuncturist?
Yes.
Probably the best thing, since if someone calls in and then there's not a medical chart established for that person, then when you do call in, leave a message directly for me, for Susan Starr, and I'd be happy to look and call you back and give you those.
All right, thank you. Mm-hmm. I'm very interested in transfer of care with an integrative oncologist. Who do you recommend?
So there are a lot of integrative providers in the state of California. There's less in LA for whatever reason. There's like a hub in San Diego. Integrative oncology, I don't know of any specific oncologist that's an integrative oncologist locally. I've had a patient that goes to you see somewhere down in Irvine, there's a provider down in Irvine, and I know someone goes to Central California, but I don't know of anyone locally for integrative oncology in terms of prescribing conventional care plus integrative medicine. That's not an easily found person. So probably the thing to do is, well, aside from looking and I think it was might have been Moore Park. There's one in Central California, one in Moore Park, and one in Irvine. I don't have their names directly, but if you Google integrative oncology or providers in those area, you could probably find them that way. As far as if you're looking to just kind of add in integrative things into your conventional treatment with your current oncologist, there are some oncology certified naturopaths who can really be helpful in terms of looking at all these different things that we've talked about to help bring kind of more of a complementary style of medicine into your current conventional medicine. I do have a name for someone who is in San Diego, but she does virtual. So if you want to call and leave a message for me directly, I can give you her name. Actually, I might think of it. It's Cicerone is her last name, at Cicerone. I don't know her last name, but she is a certified naturopath in San Diego, who specializes in oncology. The last resource I would say is University of Arizona. Their integrative medicine clinic, they have multiple providers there that I believe are probably all still naturopaths, but they all have that kind of oncology. Some have the oncology training, and you can set up a virtual appointment with them, and they can review all of your medical notes from your doctor here, and then help come up with a plan to work with them. So you have that integrative piece in addition to your conventional therapy here with your oncologist.
Wonderful. Susan, do you have any at your hospital that supports both?
In our hospital, that what?
That supports or is integrative oncologist?
No, not a specific integrative oncologist. It's more about finding kind of a functional medicine doctor or a naturopath that specializes in oncology, but not an integrative oncologist per se. That you would have to, at this point in time, that's going to probably change over the years, but there's UCSF, the center, the Osher Center, OSHER, Dr. Donald Abrams, he does virtual, he is an oncologist who does integrative oncology specifically. Now, again, he wouldn't be someone's doctor here, but he'd be a good person or someone on his team, again, to kind of have that consult with someone who knows oncology intimately, but is also dives deep into integrative medicine.
Wonderful, thank you. Are there any other questions at this time? Feel free to put into the chat or unmute yourself. And then Susan, is it Dr. Eliza Cicerone?
Yes, thank you. Yes, that's right. Yes, yes.
Perfect. I just wanted to put that into the chat. This is the naturopath that that Susan was just mentioning. Her website is in the chat if anyone is interested. Wonderful. Well, thank you so much, Susan, for your time and for all of that wealth of information. Appreciate it so much.
Yes, absolutely. Thank you so much.